everyone, welcome back. February is American Heart Month, and while some factors that lead to heart problems are genetic, lifestyle choices can also play a role. We have our favorite doctor, Dr. Stephanie Hansen, in to talk about things that parents and caregivers can do to ensure that their children and themselves are having a healthy heart. And so what is one of the big things that you want patients to know, adults or children?
Yeah, you know, the rules apply to everyone. This isn't something that's unique to adults. It's never really too early to start encouraging those healthy heart habits in your kids. And it's that basic stuff that we keep coming back to. Move your body. Eat good food, learn how to manage your stress. All of those things are so important just for your health in general, but for your heart especially. And
I think it's one of those things where the child's first teacher is their parent, whether they're in school or not. And so if you're modeling those things.
Yeah, if that's the way that you behave and you conduct yourself and your child sees that, they're going to normalize that and they're going to want to mimic those behaviors in themselves. It'll just be natural for them.
And so, but a part of it, even if some people are still super healthy, sadly there are some conditions that arise in people regardless of that. If you can touch on the genetic component.
Yeah. So, you know, you can be making all the right choices and doing those great things to support your heart health, but there are genetic conditions that can lead to heart disease. Some kids are born with abnormal hearts. There's nothing you can do about that. Some people have genetically high cholesterol and need medication to treat that. So there are some things that I think it's important to understand your family history about.
And important to talk to your doctor about as well, or establish a primary care doctor as well. And one of those things that I had never heard of doing for children before is a panel of their blood, or like a lipid panel.
Yeah. So this is a relatively new recommendation within the last 5 years or so, where we do universal lipid screening. That means we test every single kid between the ages of 9 to 11. We check their cholesterol and just get a quick look to see if that's normal or not. If their family history indicates that they have early heart disease or some of those risk factors, we may choose to check even earlier than that.
And so if it does come back higher, is there anything that can be done about then at that point?
Yeah, absolutely. So we can counsel that family about a heart healthy diet, make sure that they're getting enough exercise. And there are certain situations where medication is useful to help lower that cholesterol and reduce their risk of heart disease.
And again, that could be through no one's fault other than genetics. In that case. Okay. And so you also talk about the lifestyle choices. There's something called cardiovascular exercise.
Yeah. You know, in a simple way to think about this, it's something that gets your heart pounding. You know, something where you're moving around and you feel maybe a little out of breath or a little bit sweaty. So just that type of kind of moderate to vigorous exercise.
And I've heard with that walking is really great for people if they don't want to do it, but when you're walking, it needs to be at the pace where you slightly notice a little something going on there.
So many kids try to tell me they're getting exercise by walking around at school during the day. And really we're talking about walking with intention. So something where you do notice your heart rate kind of quicken a little bit.
Yeah, I hear you on that, because I'm kind of the same way. I'm like, yeah, I do a little walking. I walk around the office, but yeah, not the heart racing a little bit or the slightly out of breath. Okay. And so, and for adults, is that lipid screening something that they need to do as well to check it out?
Yeah, absolutely. There are recommendations for both adults and kids on when to get your lipids checked and how often. And again, your primary care doctor is a great resource to help guide you through that.
And so this, just for me, I don't know anything about the medical side of stuff, but what is a lipid? When you talk about lipid screening, what is it?
Yeah, so lipids are the fat that's in our blood, or sometimes people know it as cholesterol. So you have the good cholesterol, the HDL, and that helps protect you against certain types of heart disease. And you have LDL, which is the sort of the bad cholesterol. So when we check a lipid panel, we're looking at what's the balance of those numbers? What kind of risk does a person have based on those numbers?
And go at a treatment or lifestyle change from there?
Yeah.
All right, I love it. Got me encouraged to go and learn about my heart. Hopefully everyone at home is doing the same. Doctor, thank you.
Thank you.
Coming up here on today's show, Valentine's Day gift ideas to pamper that special someone in your life. And right now, though, let's see what's coming up in 30 minutes right after North Dakota Today.
This morning on the third hour of Today, Craig's live in Beijing covering all the Olympic action for us. Plus, the hilarious Jennifer Coolidge joins us live. And the Oscar nominations are out this morning. We are breaking down the early favorites and the biggest surprises. That's all this morning on the third hour of Today.